All right, so these are oral surgery instruments. And first off, we have the Bard Parker, which is this instrument right here. It's also known as a scalpel handle because it holds the blades, obviously, in place to make surgical incisions intraorally, so in the mouth. And you will find it on your oral surgery tray setup. So this is where the blade would go in. You kind of just slide it in, and then this is the handle. Next off, we have our scalpel blades. So here they are. It is a surgical knife that is used to make incisions in the mouth. It is safely put on the Bard Parker, our previous instrument, to have control and make the incisions in the mouth. There are different sizes. So here we have our 10, 11, 12, and 15. And then next we have our needle holder universal. It's also called a needle driver. It is a surgical instrument similar to a hemostat because of the handle and the way that it looks on the end. It's used by doctors and surgeons to hold a suturing needle for closing wounds at the end of a surgical procedure. Next up, we have our suture needle, and here we have them. The surgical needle allows the placement of the suture within the tissue, carrying the material through with minimal residual trauma. Sutures, commonly called stitches, are sterile surgical threads that are used to repair cuts. There are two different types. We have our gut plane and then our silk. Gut plane sutures are absorbable, so they dissolve by themselves, and it takes roughly about 2 weeks. And then silk sutures are non-absorbable, so you would have to go back into the office and get them removed. When you get them removed, there will be suture scissors most likely on the tray. So they have a small hook. If you can see it there. A small hook shaped tip on one blade that slides under sutures to slightly lift them before cutting for removal. This hook also holds the suture so it does not slip off the blade of the scissors prior to cutting. They are used for surgical extractions and suture removals.
Next, we have the straight elevator. It is used to loosen the teeth from the periodontal ligaments before extraction. It separates and lifts the tooth from the socket, and it's these right here.
All right, next are the root elevator flags, which are basically these. They have like a little flag tip to them. They come in right and left pairs, and they're mostly used for the posterior teeth, and they are used to loosen and separate and lift like any leftover root from the socket. And then next up is the periostal elevator, which has two ends. It has a little thicker end and then a thin end. It's used before the forceps, and it's placed around the tooth. It's used to detach the gingival tissues from around the cervix of the tooth.
Next, we have the T-bar elevator. It's used to loosen the teeth from the periodontal ligaments before extraction, to separate the tooth from the avulus, and it's used for posterior teeth, and it's this one right here.
All right, next up is the crane, which is used to loosen the tooth or the roots from the bony socket. And it looks like this. It has like a little point edge to it. And then we also have the root tip picks, and these come in like several different, I guess, shapes, whatever. And they're pointing like this, but you can either have like a angled one or you can have like a straight one. Basically what they do, it just lifts and removes small root tips that were difficult to reach.
And lastly, we have the rongeurs. They are used to trim and remove axis of alveolar bone after extractions of teeth. It is used to contour the alveolar bone after single or multiple extractions. And we have the side cutting, and we have the end cutting. And that's it for our presentation. Thank you.
Thank you.